Can an 80-year-old man still get hard? The answer might surprise you. Stick around to find out why age doesn't always stand in the way of sexual performance, and what factors could be making it more challenging. Let's be real, as men age, dealing with erectile dysfunction ID becomes more common. In fact, did you know that men in their 40s already face a 40% chance of experiencing ED? And here's the kicker. It increases by 10 with each passing decade. If you're wondering what's really going on and why, stick around because we're diving deep into the facts and what you can do about it. While ED is commonly associated with aging, it doesn't mean men 65 and older have to suffer from sexual dysfunction, although there's no cure for ED. It's crucial to make lifestyle changes and take science-based medications for it to reverse symptoms and start getting hard again. Let's dive into why ED is a common men's health issue and how you can treat it for better sex after 65. How can men get hard after 65? Erectile dysfunction is the inability to get or maintain an erection long enough for sexual intercourse. It's a common problem affecting approximately 30 million men in the US alone. Older age and ED go hand in hand. So the older you get, the more likely you are to develop this sexual dysfunction problem. Losing an erection during sex can feel like a buzzkill, but know that it happens to all of us at some point or another. It often has multiple causes, and healthcare providers usually seek to pinpoint them before recommending a treatment. Knowing the possible underlying causes of ED can guide ED treatment options. Common cause of ED in men 65. Do you ever wonder what made you lose your erectile function? As noted, there's not just one possible cause of ED. There could be multiple reasons you've lost your ability. Erectile dysfunction is linked to certain medical conditions, medications, mental health conditions, and lifestyle choices. Here's a deeper look into the more common causes of ED after 65. Health conditions. Hypertension, high blood pressure is often connected to ED. A review of multiple studies suggests that ED is commonly found in men with hypertension. According to another review, about 30% of patients with hypertension complain about erectile dysfunction to their healthcare providers. Another study looked at data from 108 patients between 2005 and 2011. Prospectively, researchers concluded that men with severe ED had a higher risk of developing hypertension and cardiovascular disease at 10 years than those with mild or moderate ED. Overall, an estimated 15% of participants in the study had erectile dysfunction at a 10-year assessment. Whoa, that's quite a high rate for ED, right? Diabetes has also been associated with erectile dysfunction. A review of multiple studies reveals that men with diabetes are 3 times more likely to develop ED than non-diabetic men. In addition to ED caused by hypertension or vascular ED, another type of ED is neurological ED. For example, diabetes could be a cause of ED as it is a condition that can cause nerve damage and vascular issues. Other diseases and medical conditions that can cause erectile tissue damage in men above the age of 65 include chronic kidney disease, multiple sclerosis, atherosclerosis, clogged arteries, physical injuries affecting the penis, prostate, pelvis, bladder, or spinal cord. Complications from surgical procedures, such as surgery for bladder or prostate cancer, urogenital diseases, and treatments that can cause ED include Peyronie's disease. Also known as penile curvature, Peyronie's disease can cause scar tissue to form underneath the penis's skin, making erections curved and sexual intercourse difficult and painful. Benign prostatic hyperplasia. A common condition among aging men, BPH, is the non-cancerous growth of prostate tissue. One risk factor for developing erectile dysfunction is having BPH or undergoing its accompanying treatment. Prostatitis. Prostatitis is a painful condition that causes inflammation in the prostate. For some men, having it may induce erectile dysfunction and cause ejaculation problems. Radical prostatectomy. This is a surgery for prostate cancer where the prostate glands are removed. Several studies suggest up to an 85% increase in ED diagnoses after treatment. If you're going under the knife, understand that ED after prostate surgery is possible. On the contrary, ED can also be a risk factor for health problems like heart disease. Erectile dysfunction could be one of the biggest warning signs you may develop certain diseases and disorders in the future. Medications. Now let's dive into the medications that can cause ED. Some medications can affect your nervous system, your level of interest in sex or blood flow to your penis, potentially causing erectile dysfunction. Of the medications includes antidepressants, selective reuptake inhibitors, esterize serotonin and norepinephrine reuptake inhibitors, esterize and tricyclic antidepressants, CAS might cause it, an occurrence known as antidepressant-associated sexual dysfunction. The likelihood of sexual dysfunction is higher with esterize antipsychotics. Medications typically prescribed for mental health disorders may induce ED. Please subscribe for more.